What's up? What's up?
Uh, how are you, good sir?
Yeah, it's interesting. Greeting again.
The formalities that happen
I know,
for
I know.
the sake of recording. Mm.
Yeah, so this is episode one of Friends in Health. I mean, just a little background. Like, we're actual real life friends who work in healthcare, and we talk about different topics outside cameras, but then on the podcast, we talk about health related issues. So, yeah, that's what we do.
In other words, we've turned privatized indabas into public forums.
Yes, yes, of course.
Yes.
So, today is the first episode, and we're going to be talking about drug and substance abuse with primary focus on Zimbabwe. And I mean, it's the topical issue right now. There's a full-on war that's happening. The government is fighting drug laws. People are getting arrested. And I always like, there's this picture. Yekuti, unobudiswa kabata zvinhu.
Like the one that recently happened, these two, if I'm not mistaken, footballers or something like that, who had
Oh yeah,
their
former footballers, yeah.
who had their taha.
Yeah,
I always like
but
that too, you know.
but I think the highlight for me, I'm going to look for the picture and put it. The highlight for
Mm.
me was Panang mom's Methodist. So
Oh, that one, yes, yes, that one. Hey, guys, like
and
that's the reality. Our beloved Maiwe Rwadzanos becoming certified drug dealers.
and the funny
Couple.
thing is
Mm.
a lot of the drug dealers in Zimbabwe, you can tell this person doesn't take drugs. Those
Oh yes,
football guys, you can tell they don't take
oh
drugs.
yes,
Like they don't get high on their own supply, which is so interesting.
oh yes. I think it's the story. There's this there's this cartoon animation, whatever. There's this famous phrase from it where see a need, feel a need, right? So clearly they are of sound mind and uh, well-being enough to see the need and try and plug it, whereas those that are already taking might just be, constantly consuming and their faculties to understand the need, has been obstructed. For them, their need is personal, but for these other people, it's mass production.
I know, and that just reminds me. I digress already. Um,
Yeah.
like Thomas Mafumo always used to get asked, "Kuti kumkanya semusingatambe chichi," and he'd
Mm.
always say, "Oh, ini ndiri pabasa, imi ndimi wazofara."
Yeah.
He wouldn't dance. But I think
Mm.
the highlight for me was actually having the former president's son getting entangled in this, and I'm like, "Eish, the drug pandemic isn't only it's no longer a ghetto problem, because if it's now visiting big places like that, it means everybody can actually be a potential. I mean, we had a lot of artists going to rehab. We've got a lot of people that we know on personal basis getting hooked on different types of things. So it's actually a more serious story and less of a joke when it now catches up with people of that stature.
Yeah. Um, if I had to be contrarian for a bit, obviously when you follow social media, there've been I think especially X, there was obviously the context of in comparison, the former football players versus the former first child, right? Where the quantities were different. I think for the other one it was like what, a gram. So people were like, okay, yeah, so one might build up a chain of sorts to say yes, the bulk quantity has become a gram to individuals, but how many individuals have these grams, right? Fair
Yeah.
enough. But on the flip side, people might say, well, are we really using up resources for state resources for Graham, where we have these major players in the business. But I remember there was also a story of some foreign nationals that were caught with some other quantity of
Are you are you
yeah,
planning on applying a Chinese visa because you're dodging, eh?
allegedly.
Alleged.
Allegedly, yes. So that is the key phrase to it.
No, but
Allegedly,
but
yes,
but I mean,
yes.
okay, allegedly, but there's actually a video of the guys hitting the
Mm.
lines. So I don't know where alleged comes in. Maybe we need to have like
Hey,
a
until
legal rep for the show, but then
un-
those guys were
until
hitting the lines.
until the due process, has the full court process has been, because I've not followed that story. I would admit, right, in terms of what its outcome was. I think they might have gotten fines or
They got
something
a
like
they
that.
got a bail for must have been $150.
So, yeah, I'm not sure in terms of how the full course of that story has gone. But until a judgment has been set, or at least I'm aware of that judgment, I will allegedly uh, claim that that is what happened and transpired, even though there was video evidence to the nature of these drugs. Because for all we know, it could have been a literal wufu,
Or a video shoot. Boys, raw music.
You see, like in all honesty, we do not know the actual facts that transpired. You get so yeah, allegedly this is what transpired. So, but then it also gives you the picture of how the face of drugs has changed in in
In the
in
country, yeah.
because we're from a generation that I guess only knew of Daha, marijuana, Mary Jane, slash in its many pseudonyms, being the most prevalent hard drug there was. And you
Yeah.
would only hear of rumors and memorings of um, any of the other white substance drugs you get. But today the picture has definitely changed. You now have drugs coming in all shapes, forms, and sizes, and for it to be openly taken, in such a public space, is obviously alarming. To say you have a generation of young Zimbabweans in there as well, right?
Yeah.
They see individuals who most probably in that whole club scene were high rollers, right? And in a society where poverty is prevalent, it becomes wealth and opulence becomes synonymous with taking drugs. And whatever their mindset is of growth, um, is like, I want to be like those cool guys,
Yeah.
right? So
But
yeah,
but but that but that you
mm,
actually mentioned, we did a little dig in on the
mm,
statistics of what it's like for drug and substance abuse.
mm,
So as far back as 2020,
mm,
Harare Central Psychiatric Hospital recorded a sharp increase of drug-related admissions from an
mm,
average of 150 cases in 2019 to
mm,
825 in
mm,
2020.
mm,
So there's a jump of almost like I don't know 500 people
mm,
extra than the usual that the psychiatric hospital used to admit.
mm,
And young people aged 16 to 25 account for 80% of drug-related psychiatric admissions. And over
mm,
half of all patients admitted to mental health facilities suffer from a substance-induced disorder.
mm,
Afrobarometer survey in late 2024 revealed that 79% of Zimbabweans feel that drug and substance abuse is widespread in their communities with 56% describing it as very widespread.
Mm,
Um, I remember I told you I visited the prisons maybe 2 weeks ago, three,
mm,
and on the waiting area, I bumped into three parents who were
mm,
talking about how their kids are inside for
mm,
drug-related issues. And I
mm,
remember telling you how I bumped into a former homie
mm,
who's serving time because
mm,
of a drug-related offense.
mm,
And it's actually crazy when you look at how a lot of psychosis and a lot of psychiatric-related issues are actually stemming from drugs.
mm,
And as much as 79% of the population agrees that drugs are a problem,
mm.
so why are we failing to fight drugs if um, 4/5 of the population agrees that this is a problem?
I think no, that obviously bring up the current statistics um in the Zim landscape is like, yeah, it's really worrying. I think, like you earlier alluded at the beginning of the recording itself, when you talked about, you and I have come across or know people, right, to who have taken drugs or take drugs, or at least are in this current space, right? And I imagine of that 79% statistic, it was also coming from individuals who individually surveyed and have an account of at least a family member, friend, neighborhood individual that has taken drugs or is known in that space. So if, like you're saying, if a good proportion of Zimbabweans can come to that agreement, then what's the story? I know obviously there's the recently launched drug master plan by
Okay.
the Ministry of Health and Childcare to tackle it. But I would say the story of drugs in Zimbabwe, or drug and substance abuse in Zimbabwe, is more than just a medical one, right?
Okay.
It's because what we now see and account for in these, what is it, hospitals, right, or psychiatric units within the hospitals, are obviously the substance use disorders and or conditions triggered by the substance abuse itself, right? Psychosis that has been
And
triggered by
offenses
substance
too.
abuse. But that's the medical effects that we're seeing, right? The individual. It's also not just a legal and or correctional services problem that we get to see individuals that are being arrested and prosecuted and jailed that we see in our correctional services in Zimbabwe. I think it also bears the markers of a social and economic problem, right? Um, when it becomes an escapism, right, to the social and economic realities of Zimbabwe. And unfortunately, that makes it more of a bigger problem, realistically, that maybe even you and I can tackle as just medical practitioners. But as individuals and citizens of Zimbabwe, it then makes this conversation very important, right?
Yeah.
To say, let's let's actually talk about what's underneath, what's underlying all of this. You and I come from a space where at least we had positive role models within our local society and even on a, spectrum, on a bigger platform, right? And even if you think about, let's say, the musicians of our day, right? Because that's the reality of it in some aspects. We really came across, or at least knew of any that were linked to substance abuse,
Well,
right?
that you mentioned about musicians, there's an ongoing fight against drugs right now. I hope we don't get stray bullets. There's a popular musician who drinks Bronclear on live. Uh, They've been doing that for the past, I don't know. They're very popular. They even have a
Mm-hmm.
hit song right now.
Mm-hmm.
And the police hasn't done anything about it.
Mm-hmm.
And it goes bad because they're even expecting. And they'll drink Bronclear live, on
Mm-hmm.
air live. And yeah, if we catch stray bullets, but I doubt they watch this kind of podcast. But if we get stray bullets, hey, it is what it is.
Maybe
But
in years to come, yes,
no, of course, yeah. But
mm,
how serious is our fight when we take it as if it's like something we do here and there?
mm,
Because it's like the traditional setup in the ghettos, where if you see shoes on the telephone line, on the electricity line, we know
mm,
the meaning. The
mm,
police know what it means. We
mm,
even know back from our neighborhood, because
mm,
I mean, Kundai and I come from a neighborhood that's actually pretty bad when it comes to drugs. Like, we know quite a lot of people who've actually lost their minds to drugs,
mm,
lost their lives, not in the sense of dying, but then you see someone veering off.
mm,
And the people who sold those drugs, we actually know them.
mm,
And what's the police doing? What are we doing? Why have we never taken the initiative to say, no, uh, Ben is selling drugs,
mm,
and put the police to task, put parliament, put whoever should be put to task? Because the people are known, the people who take are known, where the drugs are taken are known. Some of them even post live taking the drugs, and life goes on. So is the fight real, or is an optics thing?
that's yeah, that's a very valid question. I guess that even if we could invite the representative of our uh, policing system and or judicial system to say, like you're alluding to, right? Between any average Zimbabwean, um, between two people, one might know, like you're saying, where, or at least has rumors that they are aware of where specific drugs are bought, right? To know, hey, if I want Bronclear today, I can go to X and Y, right? If I want Mbanje today, I can go to X and Y. If I want to go the premier route, I can go to X and Y. But as I was processing all this, and I think we had an earlier conversation around what is it, Mbanje being a gateway drug, right? And why it's so prevalent, and then how people get into all of these other drugs after. There is one that, and unfortunately, if there were people that were catching stray bullets because of the mentioning of broccoli on a live recording on Instagram, I imagine a lot more are going to catch stray bullets by what I'm going to mention. Alcohol. It's a socially accepted. It's a socially accepted one,
Yeah,
yet
it's a drug too.
it's a drug. And unfortunately, we have to come to terms with the idea that I think as Zimbabweans, we might have a drinking problem.
Okay, okay.
And if you then look at
A
the
bold
idea,
statement for episode one. A bold statement.
yeah, because in all honesty, I've come across on Instagram a lot of different videos, right? Especially in the diaspora, right? Where people are comparing nationalities, right? In terms of be it in an
Alcohol
African context,
Olympics.
yes, African context, nationalities that drink a lot. And oftentimes, as
Those are in
Zimbabweans,
the top five.
we find top five is being it's too it's underestimating us. Top three, top
Yeah, yeah,
three,
yeah,
top three, top two,
yeah, yeah,
right?
yeah.
So that means we've not only been drinkers within our local setup, but have
It's an
exported our
international
drinking
level.
habits.
Yeah.
And this is, I guess, what speaks to the social component of drugs and the other related drugs, where alcohol, if we then look at it as the a gateway for a lot of people, right? Because we now have the idea of backyard alcohol breweries, right? That are
No, man, I know,
proliferating in
I
this
know.
way,
Yeah,
right?
I know.
Uh, and alcohol that is being bought from neighboring countries of that has suspicious manufacturing and or alcohol content, right? But it's taken and recreationally, right? So our idea of recreation within the Zimbabwean setup is, if we were to sit down, Kundai and Ellison, let's do it over a bottle of, this hard liquor, right?
Yeah.
If a party is to happen, right? If you're ever to introduce the idea of having mocktails, at your wedding, dare I tell
We're
you
not
that
coming.
there are people who are not going to come, and there are people who are going to smuggle alcohol.
But
I vividly remember a story where um some years back, right? Um, we had attended um a relative who was getting married, and they happened to attend an SDA church, right? Seventh Day Adventist Church. And so, as we know, SDA members don't
Mundas demonstrate, Hassan. Mundas demonstrate, please.
don't partake. And these uncles of mine, right? These uncles of mine, the typical, uncle behavior. Like, you know what? Yes, outside the perimeters of the church, we'll set up our little, beer hall there, open the boots, start imbibing there, that kind of thing. And I kid you not, you know, I definitely know that in some families, there's a generation and lineage of men to say it's a passage of right, or the rite of passage as a man of that family to be a drinker, right? It becomes synonymous to say, you know what, when men of this clan or family or lineage gather, there's drinking involved, right? And we grow up knowing that, we grow up seeing that. And if we were to ask the same question that the 79 individuals, the 79% cohort that was asked, to say, alongside the hard drugs that we know, the illicit drugs that we know, how much more do we know that do take alcohol and do take it in worrying quantities,
Hey,
right?
so that you meant, um, you've actually introduced another aspect that a lot of people, myself included, hadn't looked into.
Mm,
Um, so that actually means that the fight against drugs demands the regulation of general alcohol
mm,
and marijuana in particular,
Mm,
because it appears as if even the approved alcohol and cannabis
mm,
are the gateway drugs into extra drug abuse, into advanced drug abuse, because very few people are just gonna wake up, finish Form 4, and buy cocaine.
mm,
It starts in stages. You
mm,
know, people are buying alcohol, they get to illicit alcohol, and the science behind about how alcohol operates or how drugs operate,
mm,
dopamine effect, how at times the
mm,
synapse gets messed up, and now you want something higher and higher and higher and higher.
mm,
So the actual gateway drug is not marijuana, as we've been
mm,
thinking, but the
mm,
gateway drug, from what you're saying, is actually alcohol.
mm,
So there needs to be tightening of regulation along alcohol, even if it's okay, big names. Even if it's that one that I wanted to say, um, it has to be regulated, its consumption, and we need to take seriously stuff like drinking and driving and what because it's those
mm,
things that then make a gateway to people actually getting on drugs because you get numb from
mm.
drinking. I keep wanting to say that name. Those ones, they'll sue us. Those ones, they've money. I
Oh
can't.
yes, those
Those ones,
listed
they were cash.
those listed on the Zimbabwean Stock Exchange. You
Those
can't
ones.
you can't hit their bottom dollar. You can't hit their bottom dollar. You get, and the reality is, look at their statistics, right? Look at their own numbers in terms of the
They have
profit
been going
margins.
consistently upwards. They've
You
never
get.
had. They don't sink. They go upwards.
You get, if ever we have a, what is it, capital expenditure in terms of increasing breweries and or facilities, their existing facilities into capacitating for more alcohol production, right? That shows for you when they look at the Zimbabwean picture, they look at a booming business, right?
It's which is quite interesting how the poorer a society is, the more the involvement in drugs become. I mean,
Mm,
uh, this side, if you go to the sides that are actually poorer, there's like
mm.
liquor stores everywhere.
Oh
Every
yes,
corner of a liquor store. And
oh yes,
then, and that's actually happening in Harare right now.
oh yes.
I wanted to go to QV Pharmacy the other day, opposite Angwa City,
City, yes.
and
I was hurt.
and
I was hurt
and
when
I
I
saw there's a
heard.
liquor store now, and I'm like, oh, QV, because QV had been there, I'm sure, since time immemorial. And there's now a liquor store, and
Mm,
so many other places actually have liquor stores which didn't have liquor stores prior, and those places are booming with sales. So it goes back to what we are just saying, that
mm,
alcohol actually is a drug, and we're ignoring it, and we're fighting the dacha, the cocaine, the
mm,
codeine, the other names that we might not know, because there's always a
mm,
new thing every year,
yes,
and we are fighting those things, but we are
mm,
actually leaving the gateway that a lot of people are using to get into the hard drugs.
mm. And I think the story of it then becomes one of, and why you have the contrast of societies, like you're saying, where I think one of the whiplash moments for me, uh, when I came here, was the idea of alcohol that can be bought off an app, right? A drive through for alcohol,
There's
right?
actually there's actually one that I saw at
Right?
I'm not going to give them an endorsement,
Yes,
but I saw one.
there was I came across on social media the establishment of one, right? But obviously this is something that is now coming up and popping up in
Yeah.
Zimbabwe, right? Whereas this has been in existence for quite a while, for years, if not generations, right? In your developed nations, right? The stark difference is in then what is considered recreational activities in the two spaces, right? Where the idea of fun and or thrill seeking is not only limited to alcohol and driving a fast car whilst intoxicated, right? It goes into very basic and mundane things such as reading, right? Where one can even read a book, consume wine whilst reading, as an example, right? You have book clubs like that, right? But the idea that it's not just, alcohol alone as the recreational activity, right? You have a lot of parks, recreational parks, right, where people can take walks, meet and socialize with other individuals at low cost, sit on a bench, read, play outdoor, activities and games and all that.
But
And
hey, take a look right now. The recreational facilities at Harare Gardens is up for sale right now. So where one could just jump into town, uh, chill out in Harare Gardens, it's being cut up and put up for sale. So the lack of recreational facilities is actually a big deal. I mean, a lot of I know the Chitungu is what's the name? Amphitheater? Sports
aquatic,
Chitungu.
aquatic
Aquatic comp
center
aquatic
complex.
complex. It only ever comes to life if there's a band. But it was not built for that. It
You,
was not built for that. So
you get.
the lack of recreation means that people can actually find other alternatives to entertainment, other things to while up time when they're unemployed, when they're on the A-level break, when they're on the varsity break. There's not much to do. So in the fight against drugs, it also
Mm,
comes to city fathers and local government to ensure
mm.
that they introduce leisure activities that people can do at a zero cost.
Exactly, and that's the point that I was going to derive as well. There are two things that came out of what you said. A, if you're then going to think about recreational activities in the Zimbabwean context, you have to have some kind of amount of money, right? A, to travel to where
Twende Island Park
you
vacation.
know
To Magombe.
you get hapana ghetto youth parichabva ku you know kwari kubva ukoko robva rarova cross country kuti rizoita skating or inonzi archery or what is it paintball inonzi
Meaning golf and stuff.
go karting etc, that kind of a thing, right? And B, like you're saying, the role of even the city council, where everything now has a dollar value to it. You think of the uproar that came out in our in the neighborhood that we grew up in, South Atone, where we had two distinct areas that were earmarked
For
for recreational
recreation. Yeah, yeah.
activities, and they had swings in them, visible swings. Weirdly enough, I never grew up to see them work. But anyway, at least there were remnants of the purpose of what those
Of what the place was for, yeah.
what the places were for, right? And yet, years after, there was a generation of city fathers that came up and said, "We're not going to use this for recreational purposes. Let's subdivide this and make them stands," right?
Yeah.
And because maybe someone was also getting a cut of them, or maybe they owned the land, they're now going to own the land, whatever purposes. But instead of trying to invest in recreational centers, they're like, we will invest in, what is it called? Um, in stands. And I know for a fact, there are two golf courses in Harare themselves, which again have been parceled off for land. And, instead of trying to repurpose them even for a different, if we're saying, golf culture is not in Zimbabwe, cool, and it's elitist sport, and there are barriers to entry in terms of getting golf clubs and golfing equipment is high. Let's look for other things, that easily are accessible to people, right? Let's have them as walking parks, right? Let's introduce some kind of activities, physical activities, have swings, and or physical activity kind of infrastructure, right, in those spaces, so that individuals come in and enjoy themselves. But now, let's subdivide the land, and it's very sad that, like you're
Yeah,
saying, the city fathers who are custodians of the and they don't realize that they are not only the custodians of our urban land, but they're also custodians of social and recreational
welfare. Yeah.
welfare of the the people under them. And that's the stark contrast, as well as when I see, how the city fathers in some of these areas also operate. They don't operate in a just rate paying kind of mode, right? Give us rates. We are supposed to provide your utilities for you. It's also a question of how do we look after the social welfare of the individuals within our
In the
community?
society.
You
But
get. Mm,
speaking of which, mildly related is the
mm,
issue of rehabilitation.
mm,
Um, Rehab is actually very expensive.
mm,
In Zim. I remember Oscar Pambukat, he had to go through rehab, and he's doing quite
mm,
well. I don't know if you've checked
mm.
out his videos on
Oh yes.
YouTube.
Mm,
Is with Earground TV. He's doing quite
mm,
well,
oh yes. Mm,
and he had to serve some time in prison for whatever had happened. But he was
mm,
talking about how if you don't have money in Zim,
mm,
the greatest way for you to get a rehab is to go to prison because
mm,
you go there, you will get sober. You
mm,
go through the process, it'll be painful, but because in rehab, in a normal setup, if you're high on crack, they'll give you a little crack every day. In prison, you're in, there's no
mm,
crack. You go
mm,
through the whole process, you come out well. But my point is, there's actually not much affordable rehabilitation care in Zimbabwe.
mm,
The annex is not that big if
mm,
compared to the problem that we have.
mm,
So there actually needs to be a step up on rehabilitation facilities.
mm,
And what comes to mind, which is related to what we're talking about the city, is how almost every old neighborhood, I'm not quite sure about the new ones, has
mm,
something called a halfway home.
mm,
And I've seen a lot of people, okay, I've seen artists go for rehab for a questionable number of days.
mm,
And the next thing, Munato Buddha, they're back to normal, which I've always found weird that how do you just then jump back into society? Are we not supposed to recapacitate the halfway homes such that if you are getting high on drugs, when you come out, you pass through the halfway home, you are taught to reintegrate into society. You are
mm,
taught other psychomotor skills, whatever, or to enhance the skill that you have, or whatever, another course, financial management, whatever. Then you
mm,
go back in society. Because the problem we are having is you get high on drugs. Your
mm,
family or your relatives in the diaspora, team Chando, they send money. Kundai goes for rehab. You go for rehab. You come back. Ellison has been outside. And
mm,
wherever you left us smoking weed, there's now Bronco. We're gonna
mm,
introduce you to Bronco. You can only resist for so long because you've
mm,
not been properly reintegrated into society. So
mm,
I keep questioning myself. People go for 2 day long rehabs. I'm not quite sure the
mm,
appropriate time someone's supposed to spend in rehab, or maybe
mm,
it's relative to the degree of addiction. But
mm,
people spend like 2 weeks and they're back and they're posting and life is as normal. And I'm just like, is
mm.
this the proper way that we're supposed to be doing it? And
I think the scariest part of it, like from at least from an individual with some insight into the rehabilitation process,
Yeah,
right?
you actually spent some
There's,
time as annex, right? No pun
uh,
intended. I mean,
beyond that, there's what we call the cycle of change, right? And in it means that there's the what they call the pre-contemplation, where everyone around you sees the problem, but you don't see it. You get into the contemplation phase where you now start to think and consider it. You get going into the action phase of it, and um, ultimately, because it is a cycle, there is the relapse part and aspect of it. So if you still find yourself in a space where the initial triggers and or supporting structures towards your drug use are still existent or prevalent, relapse is not a question of if but when,
so
right?
it is going to happen.
It is
So
going to
so
happen.
so
That that
from your analogy and your explanation of the stages, are you saying that the minute someone gets into the drug trap, they can't come out? They can only it's more like a drowning effect where you pop up your head sometimes, but you're gonna sink.
so this is what I'm saying. If the initial triggers and or prevailing what is it? Um factors for you to go there, right? The relapse will take different shapes and forms. You know, there might be a point where you are sober, clear minded that I do not want to partake of this. But there's a moment where there's the inner temptation that will hit you, right? So there needs to be it a personal barrier towards that consumption, or be it institutional barriers to prevent you from getting there. And by institutional, I might mean maybe the setup of where you're living, and or now you find yourself doing better, well, and all that financially or socially. You have a social network of individuals that either can relate to your situation and or support you to pass pass through that. But even in that, some might say, obviously, maybe it depends in with how far a person or how far gone a person might have been using those substances for them to the duration of time. But even the rehabilitation is not just going into a specific unit for a specific amount of time. It's an ongoing process, right?
So even when you've been released, you still are a patient.
You are still, I wouldn't say a patient because then it invokes obviously medical terms, but you're an individual who we need to support. If I'm to tread the lines of being politically correct, right?
Okay.
You're an individual who we need to support because the biggest question is obviously why or how did you get into it, right? And if those questions have not been answered within that 2 week period, 3 week period, or month period, right? Then we'll find ourselves in the same space in a different time again, right? So if the why you got in there or the how you got in there are not answered, because an individual might go into the rehab space, and when they got in, when they go out, their jazzman is 2 houses away from them.
Oh, one got a cottage.
You get, you know. So that way you get,
Yeah.
yeah. If they got in because they didn't have any meaningful recreational activities, right? And or they had stressors to their life. If they go out and the stressors are still existent, we have sobered them in quotes, but the stressors still exist.
So they'll come back and they'll relapse.
They relapse. But that even you're talking about it in terms of how expensive the the rehab process in Zimbabwe is, right? I think
Extremely
there was
expensive.
in terms of governmental institutions that I'm aware of. I know of off the top of my head, I might be factually incorrect here. You have the Harare or Salim Mugabe uh, psychiatric unit. You have the Parenya to a psychiatric unit. You have the what is it? The Ngomahuru in Masvingo.
Now,
Then
smashing
you have what is it?
Ingucheni.
The Ingucheni. So I stand corrected as well. Then you have the prisons and correctional services, which a lot of people are not aware of because you can go in as a private citizen, right? Where your family and or loved ones volunteer you to the system, right? For
That doesn't sound nice, but well,
it's typically reserved for situations where an individual has gone through maybe a range of other, they've gone to Ngomahuru. It's not war. It's not. Um,
it's not working out.
it's it's not giving off the desired results. They've gone to Ingucheni, again, not the desired results. They've gone through this, psychiatric units and not the desired results. So, they then volunteered to the state, and in it, you're like, okay, we have an individual with substance-induced psychosis or substance use disorder, and as such, you know, can the state help them? Because in that center you have dedicated psychiatric nurses and psychiatrists,
Mhm.
right? As part of that. So yeah, you have those institutions, but the
But is the do we
the
do we have
capacity.
do we have yeah, speaking of
Yeah.
capacity, do we have any involvement from the church? I'm yet to hear. Maybe they are there, but I haven't heard of a rehab facility run by a church, and I think the church really heavily needs to be involved in this, um, because no. Uh, hear me well. The church already has infrastructure in terms of like reach to community. And it is very important that the church gets involved in this because the statistics that we are giving, we're talking of like well into the thousands, if not hundreds of thousands, to be modest, of young
Mhm.
people who are using drugs. And
Mhm.
all the facilities that you mentioned cannot accommodate all those people.
Mhm.
And it would be fantastic if the church, or not restricted to Christianity only, but then if religious institutions also chipped in, and in terms of infrastructure, of course, would need like the professional people to
Mhm.
handle the job. But I have not heard. Maybe they're there, but
Mhm.
the fight of against drugs is usually more of my speech, my campaign, my
Mhm.
my gig, and of which at the gigs we will go there and take the drugs.
You
Which
know.
yes, because at the gig we will go there and we'll actually take drugs. So
Mhm.
it would be lovely to have, Catholic
Mhm.
Reform Center, to have Anglican
Mhm.
Reform Center, UFIC Reform Center. It would be actually fantastic if the church can chip in to the fight against drugs.
Mhm.
I don't know if they are already not involved.
Well, I'm not aware myself, and I think you rightfully point out a good social institution that we can use and that is at our disposal, right? When how are we even to have individuals flock uh, to Christ if they are already stoned, right?
Precisely. Yeah.
Um, so that becomes, I guess, as a Christian myself, that becomes a form of ministry, right?
Exactly.
To
Yeah.
say, how are we bringing back individuals into the fold? And in as much as I'm a, you know, believer, and because I have seen um, some situations, we can't just pray them away,
We've got
right?
to have action. Precisely.
You
We're
know,
not going to do an anti-drug and substance abuse crusade and it will work. I'm sorry, it won't. We have
right?
to.
We
We
won't.
have to follow
And
up with action.
I say that because having seen individuals with substance use disorders and their stories and their families' conversations, they will speak to this, right? Where they have tried all other methods. You know, they have gone to these prayers, they have done this and that. Yes, I don't dispute that there are other personal stories, right, out there that people say, you know, all of that happens. But it takes where people might fail to understand. When it comes to any issue or story of beat mental health conditions, there's what is called emotional insight and intellectual insight, right? So intellectual insight is knowing that if if I'm to break it down to the most simplest of explanations, if possible, intellectual insight is knowing that if I take X drug, there is a risk of psychosis, right? You
Yeah,
know
yeah,
the
yeah, 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 yeah. I've heard that like stuff
you
like
know
heroin. One time you're gone.
even for some that have taken daha, right? You know,
Touch is the
if
move.
you're prone to it, if there are let's say markers genetically for you to go down that route, you know, this is why I've never attempted because I might fall, you know, prey to it, right? So some might take mbanje and then off ramp, right? So it's the idea of, oh, I know that if I take this drug, there's a risk for psychosis, right? If I take this drug, this is what will happen to my liver, my lungs, my brain, etc. Knowing the intellectual effects of it, right? Then there's the emotional insight, which is then knowing how that impacts you as an individual and those around you, right? So
Yeah.
this is whereby, you know, coming across some individuals with high intellect and know, you know, the costs and will tell you, hey, if I take this drug, this is what happened, this will happen, this will happen. But understanding and um, comprehending what that means to not only to their lives, but the people around them.
Speaking of high intellect,
Mm,
I have personally heard of two medical
mm,
doctors who
mm,
would put high on anesthesia.
mm,
Yeah, like they would just, and it was so bad. I remember at one institution I was working at, somebody had to get fired because the drug cabinet kept getting raided, and not by patients, by clinicians who know the effect, who know the results. And so we even have drug abuse at that level. Your doctor could probably be on drugs. Your psychologist or your psychiatrist could actually be high on some form of drugs. So I remember back in primary school during the HIV times, there was this saying that anybody can be infected by HIV, but everybody is affected by HIV. And putting it in today's times, everybody can go onto the drug spectrum, but actually, I can put it as like anybody can go on the drug spectrum, but everybody is actually affected by the drug situation. You might just not know. It goes like from the person who drove you Mukombi in the morning. Those guys, again, I don't want to catch strays. It goes to the people you're working with at work, the guys you're learning with at school. So the drug issue, the conversation cannot just be limited to occasional events or a few people talking about it, because like HIV is something that's actually affecting anybody and everybody. Yeah.
Oh yes. And that you say it, it raises up a sore point for me that I have been concerned about, and it speaks to the earlier discussion around alcohol being a gateway and entry drug, and the idea of being affected. I'm worried and concerned, and I know people will come at me. This is going to hit a sore spot. But you and I have friends, right, in the medical space.
Yeah.
That we know in terms of have concerning alcohol consumption. And what is even way more concerning is the idea that sometimes going into theaters, right, hungover and or still drunk becomes a badge of honor as opposed to a thing that we can call to to order, right?
I actually think that as part of our drug fight, breathalyzers should be everywhere. I worked at an institution that had breathalyzers. You put yourself to order, my friend. No one will tell you, because if it's gonna say in these places we only accept 0.5% alcohol, you regulate yourself to that. If it says 0%, I remember but back at my time at Anglo, it was 0%. Any percentage, you'd get fired on the spot, no matter who you were. So I think it's also important that civil service, public service, introduces fertilizer, because as the biggest employer, once they institute something, everybody else is going to follow. So that will actually discourage people, and that will solve the issue of overconsumption of alcohol, and also limit the people who are on the gateway to harder drugs. But our time isn't looking good anymore. We've got to conclude. So, what are your parting words with regards to our first episode?
Well, I think it's been loaded, and I think we if I were to be honest, we barely scratched the surface of what the substance and drug problem in Zimbabwe is. But hopefully it really gets the conversation going for a lot more people, and not just it's and let it not end in a conversation, because we have been having these conversations Pama Bridge, we've been having these conversations, Pama Podcast, we've been having these conversations in national indabas and all that, but to say, let's actually do something. What does that something look like? It means that the social institutions, right? If government says we don't have capacity to fully spread our tentacles across the board, invite institutions such as churches, right, to help out. But beyond that, education within the schooling system needs to then speak to this. But yeah, it's not an individualized fight. It's a fight where we are seeing generations waste away. And if there's any hope for Zimbabwe, we need to get everyone on board with this. But yeah, to anyone who caught strays in this, our apologies. We are concerned citizens.
Yeah.
We are people who have seen people around us fight this battle of drugs, and we only want the best for Zimbabwe and its people. And yeah, hopefully this also serves as a good introduction to future episodes in terms of where we can go and how a discussion can be shaped. But yeah.
So it's been a good one, friends, and it's been a good run. So, well, for me, I already said it. Anybody can get addicted to drugs, but everybody is affected by drugs. So the conversation has to leave the chat box and go into action, and we need to all be involved in the fight for drugs. So, to next episode, that's it from friends, and yeah, all of you viewers actually now are friends. So, welcome to the friendship bench.
Hey, trademarked, my guy. Trademarked. You are
That's okay. Okay,
Changata pesa
welcome to the
zvakanaka.
friendship group. Welcome to the
Changata
friendship
pesa
group.
zvakanaka.
Welcome to the friendship group. Okay,
So
sure.
good. No problem.